Swollen feet and heavy legs are not just uncomfortable, they are a sign that fluid is trapped in your lower extremities and struggling to return to your heart. When you are over 60, the natural valves in your leg veins that fight gravity can become less efficient, leading to that tight, puffy feeling around the ankles. However, you can manually assist your body in moving this fluid using simple mechanical actions. We are going to go through 7 specific fixes that can improve circulation and reduce swelling, often starting to work within just 10 minutes. First and most immediate way to move fluid out of the feet is to manually activate the body's natural pump. Your calf muscles are often called the second heart by doctors. This is because the heart in your chest pumps blood down to your feet easily with the help of gravity. But getting that blood and fluid back up requires muscular effort. The veins deep inside your lower legs rely on the squeezing action of the calf muscles to push fluid upward. If you are sitting still, this pump is turned off and fluid pools. To perform the gas pedal fix, sit in a sturdy chair with your feet flat on the floor or extended slightly in front of you. Lift your toes and the front of your foot off the ground as high as they can go while keeping your heels planted. You should feel a stretch in the front of your shin and the back of your ankle. Hold this for 1 second. Then, press your toes down firmly towards the floor and lift your heels up, exactly as if you were pressing the gas pedal in a car. When you press down, you should feel the large muscle in the back of your calf tighten hard. This tightening is the key. When that muscle hardens, it physically squeezes the veins buried underneath it. This pressure forces the stagnant blood and fluid upward through the one-way valves in your veins and back towards the torso. Repeat this pumping motion rhythmically. Up, down, up, down. Aim for 20 to 30 repetitions. This works well for most older adults. The beauty of this movement is that it requires no equipment and can be done anywhere, while watching television, reading, or even sitting at the dinner table. It is purely mechanical. By manually operating the pump, you clear out the congestion that causes swelling. You can feel the difference almost immediately as the stiffness in the ankle begins to fade. This is easy on the joints. 2. Ankle rotations. Here is another simple habit that targets the joint itself. While the gas pedal focuses on the calf muscle, ankle rotations focus on the flexibility of the ankle joint and the surrounding tissues. Swelling often causes the ankle joint to become stiff and rigid. When the joint is rigid, circulation is further restricted because the small vessels around the ankle are compressed by tight tissue. Mobilizing the joint helps to wring out the tissues and encourage fluid movement. To do this, sit comfortably and lift one foot slightly off the floor. Imagine there is a pencil attached to your big toe. Use that imaginary pencil to draw a large, perfect circle in the air. Move slowly and deliberately. Try to make the circle as wide as possible. You want to reach the very edges of your range of motion. Do 10 slow circles in a clockwise direction. Then pause and do 10 slow circles in a counterclockwise direction. Repeat with the other foot. This gentle motion helps lubricate the joint. It also stretches the tendons and ligaments that surround the ankle. When these tissues stretch and relax rhythmically, they create a subtle pumping effect on the lymphatic vessels in the area. The lymphatic system is responsible for draining excess fluid, but unlike the blood, it has no heart to pump it. It relies entirely on movement. Ankle rotations provide the specific movement needed to stimulate this drainage around the foot. Most older adults can try this safely. If you hear small clicks or pops in the ankle as you rotate, that is generally normal, provided it is not painful. It is simply gas escaping from the joint or tendons, shifting. Focus on smooth, controlled movement rather than speed. This helps the body function more easily. 3. Strategic elevation. 1. More easy change utilizes gravity to do the work for you. You have likely heard that you should put your feet up, but for this to be a true circulatory fix, the position matters significantly. Simply putting your feet on a footstool or ottoman is comfortable, but it is often not enough to drain significant swelling. On a footstool, your feet are usually still below or level with your hips. To effectively reverse the pull of gravity, your feet need to be elevated above the level of your heart. This creates a downward slope from your feet to your core. When you achieve this angle, gravity switches from being your enemy to being your ally. It naturally pulls the heavy, deoxygenated blood and accumulated lymphatic fluid out of the legs and back into the central circulation where it can be processed by the kidneys. To do this safely, lie down on a sofa or your bed. Stack 2 or 3 pillows at the foot of the bed. Place your legs on top of the pillows so that your heels are clearly higher than your chest. Relax in this position for 10 to 15 minutes. You can do this at home. During these 10 minutes, you do not need to move. The angle does the work. Many seniors find that doing this specifically in the late afternoon, when swelling tends to be at its worst, provides the most relief. It acts as a reset button for the circulatory system. If lying flat is uncomfortable for your back, you can prop your head and shoulders up with pillows as well, as long as the feet remain the highest point of the body. This gentle adjustment helps with reducing heaviness quickly. While you are in this position, breathe deeply. Deep breathing creates a vacuum effect in the chest cavity, which further assists in pulling blood up from the legs. 4. Toe scrunches, the towel grab. Here is another helpful step that activates the deepest muscles in the foot. We often forget that the feet themselves contain many small muscles. These are called intrinsic muscles. Just like the calf acts as a pump for the leg, these small muscles act as a pump for the foot itself. When we wear stiff shoes all day, these muscles become lazy and weak. They stop pumping fluid effectively, leading to puffiness, specifically across the top of the foot and toes. To wake them up, try the towel grab. Sit on a chair with your feet bare. Place a small hand towel or washcloth flat on the floor in front of you. Place your foot on top of the towel. Now, use your toes to scrunch the towel up. Curl your toes inward, grabbing the fabric and pulling it toward your heel. Release and spread your toes out, then grab again. This action forces the small muscles in the arch of your foot and the toes to contract strongly. As these muscles contract, they squeeze the deep veins located in the sole of the foot. This pushes blood out of the foot and into the ankle, where the calf pump can take over. This is simple to do. Aim to scrunch the towel 10 to 15 times with each foot. If you do not have a towel handy, you can simply practice curling your toes as if you are trying to pick up a marble from the floor, then spreading them wide. The spreading part is just as important as the curling part. Spreading the toes creates space between the small bones of the foot, relieving the compression that often accompanies swelling. Most older adults can do this comfortably. This exercise also helps strengthen the arch of the foot, which improves your balance when walking. Better balance leads to a more confident stride, and a confident stride means better circulation overall. This helps the body function more easily. 5. Upward stroke massage. Another gentle adjustment helps with manual fluid drainage. Sometimes the fluid in the feet needs a manual guide to start moving. You can perform a simple massage on yourself to assist this process. However, the direction of the massage is absolutely critical. Many people instinctively rub a sore foot back and forth. But for circulation and swelling, you must only stroke in one direction, upward. You want to push the fluid toward the heart, not back down into the toes. Sit comfortably where you can reach your legs, or have a partner help you. Start at the toes. Using the palm of your hand or your thumbs, apply gentle but firm pressure, stroking from the toes, over the top of the foot, and up toward the ankle. Imagine you are squeezing toothpaste out of a tube. You are gently moving the fluid out of the congested area. Continue the stroke from the ankle up the shin and calf toward the knee. It does not need to be a deep tissue massage. In fact, lighter rhythmic strokes are often better for moving lymphatic fluid, which sits just under the skin. This works well for most older adults. Do this for 3 to 5 minutes on each leg. You can use a small amount of lotion or oil to prevent friction on the skin. This keeps the skin hydrated, which is important because swollen skin can become dry and prone to cracking. Never massage deep into the back of the knee as this area is delicate. Just stroke upward until you reach the knee and then release. This is easy on the joints. By manually pushing the fluid upward, you clear the pathway for new oxygenated blood to enter the feet. This often brings immediate relief from the throbbing sensation that comes with swelling. This keeps the body balanced. 6. Warm water soak. One more easy change uses temperature to open the vessels. Heat is a natural vasodilator. As we discussed in other contexts, vasodilation simply means the widening of the blood vessels. When the vessels in your feet are constricted due to cold or inactivity, blood cannot flow freely and fluid gets trapped. Soaking your feet in warm water encourages the blood vessels to relax and expand. This expansion allows blood to flow more easily and helps flush out the accumulated fluid. It also relaxes the muscles and tendons, reducing pain and stiffness. Fill a basin or a bathtub with warm water. It should be pleasantly warm, not scalding hot. A crucial safety note: if you have diabetes or any condition that reduces sensation in your feet, neuropathy, you must be extremely careful with water temperature. You might not feel if the water is too hot, which could lead to burns. Always check the temperature with your elbow or a thermometer before putting your feet in. It should be around body temperature, 98 to 100 degrees Fahrenheit or 37 degrees Celsius. For an added benefit, you can add Epsom salts, magnesium sulfate, to the water. Magnesium can be absorbed in small amounts through the skin. Magnesium helps muscles relax further, potentially easing any cramping in the feet or calves. Soak for 10 to 15 minutes. This fits into any routine. While soaking, you can perform the ankle rotations or toe scrunches we mentioned earlier. The combination of heat and movement is very powerful for circulation. After the soak, dry your feet thoroughly, especially between the toes. Moisture left between toes can lead to fungal infections, which seniors are more prone to. Dry feet are healthy feet. This helps the body function more easily. 7. Standing heel raises. The final fix is the most powerful activator of the calf pump. We started with the gas pedal exercise, which is done while seated. That is excellent for when you are resting. However, if you are able to stand safely, standing heel raises provide a much stronger pump because you are lifting your entire body weight. This creates a high-pressure contraction in the calf muscles that clears veins very effectively. Stand behind a sturdy chair or at the kitchen counter. Hold onto the surface for balance. Do not rely on your balance alone. Safety is the priority. Keep your legs straight, but not locked. Slowly lift your heels off the ground, rising up onto the balls of your feet. Go as high as you comfortably can. Pause at the top for 1 second. Then slowly lower your heels back to the ground. Do not drop down. Control the descent. The downward movement is just as important as the upward movement for muscle engagement. This is simple to do. Aim for 10 repetitions. Rest for a moment, then do 10 more. This forceful contraction squeezes the deep veins maximally. It drives blood upward against gravity with significant force. Doing this a few times a day, perhaps while waiting for the kettle to boil or brushing your teeth, can prevent fluid from accumulating in the first place. Most older adults can try this safely. If you find standing difficult, stick to the seated gas pedal version. Consistency is more important than intensity. The goal is to keep the blood moving, not to build bodybuilder muscles. This habit keeps the body balanced. Summary of fixes. To quickly recap these 7 fixes for foot circulation and swelling. First, use the gas pedal motion while seated to pump the calves. Second, perform ankle rotations to mobilize the stiff joints and encourage drainage. Third, use strategic elevation with pillows to let gravity drain the fluid toward the heart. Fourth, do toe scrunches to activate the small pump muscles inside the feet. Fifth, perform upward stroke massage to manually guide fluid out of the legs. Sixth, use a warm water soak to dilate blood vessels and relax tight tissues. Seventh, practice standing heel raises for a powerful circulation boost. These fixes are mechanical, simple and effective. They do not require medication or complex equipment. They rely on the simple physics of movement, gravity and pressure to help your body do what it is designed to do. If you know someone over 60 who struggles with swollen feet, share this video with them and subscribe for more simple health tips.